what works in that home is what's gonna really promote that buy-in for those carryover practices. You also wanna look at pre-linguistic skills, so does that child have cause-effect relationships? Do they have means to an end? Are they able to develop these skills as you continue with therapy? You also wanna look at object permanence, so do they have the ability to learn that, this picture card that says apple, there's a word on an apple, do they know that when I hand that to my communication partner, or if I press that button that says apple, then I get that object that I want? And you also wanna look at that child knows that the AAC is their primary voice, especially when you look at high-tech, iPads and things. You don't want any other apps or things on there because that device is just there for their voice primarily. So now we're gonna jump into potential candidates. So one of the main populations that you see AAC device use with is autism. And we found throughout our research that 25% of autism, children with autism remain non-speaking throughout their childhood years, which is why AAC is a main mode of communication that SLPs try to use with those students. And you wanna use AAC as a facilitator to support communication as much as possible. So some other potential candidates are some congenital disabilities, if you actually have speech or intellectual disabilities. You don't wanna rule out that adult population. Our presentation mainly focuses on child population, but adults that have acquired disabilities such as ALS or aphasia can also benefit from AAC. If you're post-surgery from having a laryngectomy or a flossectomy, or even in temporary situations such as an intubated patient or an acute loss of voice.
Okay, so we have kind of presented this as a handout for clinicians and for caregivers, so this is going into our clinician standpoint. So our first part here, this is a lot of words, we don't have to go over all of them, but this is essentially telling you that within our scope of practice, it is appropriate for us to evaluate and assess and do therapy with AAC, that we can find the appropriate AAC device for each of our clients that need AAC, and that since AAC is another way to communicate, it definitely falls within our realm of our practice. So the clinician's role in using AAC is first you start with the interview, obviously, to find out the needs of the client with AAC, and you assess what goals would be appropriate for them, and finding out what kind of technology would be good for them. Maybe it's low tech, maybe it's high tech. Evaluate their linguistic skills, and you can personalize their therapy for each client. We also want to keep in mind the Bill of Rights of Communication, which you may not remember this, but essentially states that every person has a right to communicate. And we're also very involved in educating the caregiver, and if the client is old enough, educating them on using their device, programming, and setting it up. So going more into what I was just saying, you have to determine if this client is going to use high tech or low tech, and that is done specifically in the assessment. Obviously that can be changing if the client is growing and they might have higher needs to now have a high tech device. That can be an ongoing process, but we're also going to be very involved in the parent coaching. So we're going to make sure the parent is going to be really in charge and really know everything about this device. The setup, they're going to be in charge of charging it, they're going to need to know all the software and the programming, and they need to know that this is not really an iPad, it's going to be the client's communication device, and how it's their voice to talk to everyone. Obviously we're very involved in the initial setup, but after that it's kind of the parent's job to know everything, and if the client's old enough, maybe the client too. We also are the main communication point with the AAC distributor to pick out the appropriate AAC device.
Alright, now we're going to be talking about how to get the parents on board. So like Peyton mentioned, involving the parents in what they see this device as for their child, whether that's purely being used as their client's voice, or if it's for them to gain more independence throughout the process. If parents don't agree on what the goal is, AAC might feel pointless. Also providing them with some education on AAC, low-tech and high-tech options, different types of high-tech, and that it does not hinder spoken language ability. And like Peyton and Megan mentioned before, that parent coaching will continue to be an important part of speech therapy. So some some more things to discuss with the parents. If they see the device being used short-term, if they see it being a long-term use, if it will be their main mode of communication or secondary, and how the client is currently communicating. Do they have any spoken language? Are they purely using gestures? Or do they have some form of AAC already? Alright, so now we'll talk about an AAC assessment. So like we already talked about, we're gonna figure out what the goal is with the device. We're also gonna figure out what will be the most functional and easiest to use for the child, or least restrictive. We're gonna look at their receptive communication abilities, how their visual acuity is, their physical and motor abilities, can they point or do they need an eye tracking device? And this would be a good time to involve OT and PT, consult with them if they're not already on board. And then assessing a variety of symbols. Do they need just a picture? Would the picture and the word be most appropriate? What the grid size would be, we don't want it to overwhelm the client. And then trialing different apps and different device types.
Okay, so now we're gonna dive a little bit more into the different kinds of devices. So like I said earlier, we have the aided and unaided devices. And when you use aided communication, it's communication that uses external support. This can be low tech, such as picture cards or text, or high tech, such as an iPad, a tablet, or some sort of different speech generating device. Unaided communication doesn't use any technology, it's only natural communication that uses your body parts. So that'd be your signing, your gestures, or your facial expressions. And throughout our presentation, we did more of a focus on aided communication, having that external device, because we found through our research that can be both a barrier and a facilitator to having an kind of like a external appendage for the child to use in order to communication. So going a little bit deeper into our low-tech options, we have PECS to start, which is a picture exchange communication system. Its primary use is for requesting and enhancing emergent communication skills. And then we have POD, which is the Pragmatic Organization Dynamic Display. This is a choice board that's separated into different categories, and the goal is to require as minimal page turns as possible for efficiency of communication for that child. It can also include an alphabet keyboard or a yes/no choice board. So this next slide here just gives an example. So the one on the far right with the sentence strip is an example of text. So what the child would do is, depending on what level they're at, they can form a sentence strip, and then they can give that sentence strip to their preferred communication partner, and that's how the communication exchange would be completed. If they're not to that level, they can just pick up whatever picture card or word they want, and the exchange can be completed that way. The other picture is an example of POD. So down towards the bottom, you can see it's broken down into different categories. The picture that you see here is adjectives, and then along the side is some exclamatory words for ease of use that they can have right at their fingertips on every page. And then here is an example of a yes/no choice board and an alphabet board. And the benefits to low-tech technology like this is that it's very customizable. So you can use actual faces, you can do like a thumbs up or a thumbs down. If they don't like the alphabet board like this and they prefer like a keyboard, you can make it to whatever the client prefers.
Okay, so now we'll go more into the high-tech devices. So we've kind of split these up into speech-generating devices and then a tablet that you can put apps on to make it into a speech-generating device. So we'll start just with the speech-generating devices. So our first one is Tobii Dynavox. So these are just a few. Obviously there are more options, but these are the few we're gonna talk about. So for Tobii Dynavox, this is a more expensive one, but with that you do get a lot of different options, and it's very customizable. You have many different sizes available. You have eye tracking, and you can attach it to a wheelchair very easily. So if you have a client with multiple disabilities, this might be a good option. Next we have Lingraphica, which can be accessed in 2 different languages, which can be really helpful if your client is maybe bilingual. This one does not have eye tracking, and it can be not as accommodative, so maybe there's some different abilities there, but the bilingual part can be really beneficial. And our last one is Pocket GoTalk 5-level communication. This is the cheapest option, but It has less modes, but obviously if you're looking for the cheaper option, this might be the way to go. Next, we'll talk about using an iPad or a tablet as a speech generating device. So the first one we'll talk about is Proloquote to Go. So if you guys remember from our AAC class, this is the app that we used. So this is really easily customizable. It has a lot of features and you can access a lot of different boards pretty easily. But as I was saying, there's no eye tracking on this one as well. Maybe that's something you can add on, but does not come with the app. A lot of these obviously don't come with that because it is just an iPad. Next, you can have Tobii Dynavox bought kind of as a subscription, just put onto an iPad. So all those same abilities can kind of be put onto the iPad from Tobii Dynavox, but it is not a speech generating device in the same way. And our last one is Speech Assistant AAC, and this is also an app that has more functional phrases, so it can come with pictures or it cannot. So it might be better for someone who is higher level in their literacy because there's a lot of already pre-made phrases right in there. So now I have some pictures. We've taken all of these from the websites of all the companies, but this is an example of Tobii Dynavox. You can see it kind of has some different sizes available. You can see how it could attach to a wheelchair. This is Proloquote to Go. So you guys might remember the app. So I love that it has the different colors for different types of words and categorizes it really well. And it's super easy to access different boards all at once. And our last one was the Speech Assistant. So you can kind of see how it has the functional phrases kind of ready. So if a child is, higher level with their literacy, this could be a really good option. So they feel like they can communicate at a faster rate.
Alright, so now talking about actual therapy with the AAC device. So it's important to get to know the family and the child before beginning therapy, getting to know what interests the child, as every child is unique. And the goal is to grow the child's communicative competence. So there's 4 main domains for that. Linguistic competence is their receptive expressive language. Operational competence, how well they're able to use the device and troubleshoot. Socially, are they able to interact and communicate with a wide variety of people? And then strategic competence, are they able to repair those communication breakdowns that may happen? So we want our therapy to focus on more than just requesting, using naturally occurring routines such as play, and then you can use modeling that works with aided and unaided. There's a variety of different approaches. There's more structured approach, such as discrete trial training, which involves breaking therapy goals into smaller chunks, and then rewarding the child for the desired behavior. There's incidental teaching, such as enhanced language training, and this is a more naturalistic conversation-based approach that takes into account the child's interests, which is why it's important to get to know them. Naturalistic developmental approach, an example of that is JASPER, which stands for joint attention, play, engagement, and regulation. So all of those pre-linguistic skills. And then we do the prompting hierarchy on here. So when you're initially starting to work with that child, they might need more hand over hand, but as they gain more independence, maybe just a verbal cue or verbal prompt would work best. And then having the parent or caregiver watch your sessions and engage in them, and educating them on why you're doing what you're doing will be very beneficial. Alright, so we're going to talk about the caregiver now and what the caregivers have experienced. So all of this information is from a systematic review and qualitative metasynthesis study that explored positives and negative experiences that parents have had with AAC. So first, the positives. Some parents have said that the AAC system has increased their child's autonomy and self-esteem. The child is able to make more requests, and it has a higher success when used both at home and school. So some of the negatives, the parents did not feel supported or knowledgeable about their child's AAC device. They stated that certain settings make AAC use difficult, such as in the car, at the park. They had to travel a long distance to meet with an AAC specialist, and kind of going off of that one, they do not have fast and easy access to AAC help. Their child doesn't understand how to use their device, and therefore doesn't. And then parents not familiar with chosen AA system, and of course, the high cost and lack of funding. So as clinicians, we can use this information to kind of better serve our families that we may work with.
Okay, so looking more into how caregivers can be better educated to promote carryover, a lot of this comes down to the SLP educating